Well, childhood obesity impacts 1 in 5 children and teens in the U.S., according to the CDC.
Our health reporter Haley Hernandez is with us this morning. She's been digging into the reason why and the extreme measures that some are taking to reverse it.
So Dr. Manish Kumar sees patients in a medically underserved part of Houston, and he says that child obesity rates are even higher than the national average in his practice. The problem is compounded during the summer when kids are home and can lead to lifelong problems.
Nobody's denying kids today have it different.
I feel sorry for big kids.
You know, you look around at children today and, just the epidemic of it is so prevalent.
The lack of activity, the breathing issues, heart issues.
Dr. Manish Kumar in Southwest Houston says 30% of his patients as young as 3 years old are facing weight-related problems.
One of the ones that we deal with on a day-to-day basis is snoring. When you're heavier than you should be, you're more likely to snore, and when you snore, it increases the strain on your heart. These kids have more mood, attention, focus, and behavior issues, but in the long run, they have a much higher lifetime risk of high blood pressure and heart attacks and strokes.
It's well known not to eat junk food, so the solution is more complicated than that.
There could be psychological factors, cultural factors, access to food. We see a lot that kids eat what they can get their hands on.
At what age do you see this becoming a problem?
Very early in life. I would say as soon as children that might be formula or breast milk fed are weaned from either or both of those, we start to see very poor lifestyle and dietary habits.
That's 1 year old.
Haley, I'll tell you, there are parts of the developing world, third world countries, where sodas like Coca-Cola in particular was safer to drink than water. Well, that initiates the cascade of unhealthy weight gain and then drives your physiologic need for more calories.
Soda's aside, he says all habits starting in childhood have the potential to last a lifetime, which is why he coaches families on time management, healthy food choices, and weight loss strategies. But most adults in children's lives are working, sometimes working 2 jobs, not meal planning. We asked several parents, and most agree you go for what's fast.
Convenience and time.
Anytime that we take the kids to a fast food, usually it's because something happened and we couldn't make the meal ourselves.
It's time, it's, trying to keep up with the hustle of things.
We live in hustle culture, and now the need for some kids to lose weight is more urgent than taking time to fix bad habits. In some extreme cases, Dr. Kumar recommends surgery.
The number of youth 10 to 19 having metabolic and bariatric surgeries has been rising and jumped 19% between 2020 and 2021. It's not encouraged, but it's an option, as are diet pills.
We don't conventionally turn to diet pills in children for the purpose of weight management. We use so-called diet pills for the purpose of addressing underlying metabolic problems.
For local parents who never want to be faced with that choice, they say the topic of weight is one they will address.
And see what are some healthier options. What are the bad habits that I have? See if I can break some of those bad habits.
Pinpoint where their problem is coming from, and then who do they talk to? If we're talking about people who already don't have a lot of access to good resources, where can they go?
Go to your physician, go to your pediatrician, go to your family practice doctor.
And the Eating Recovery Center of Houston, who deals with eating disorders, they say children should be left out of the conversation. Leave the room while parents and pediatricians discuss obesity so as not to psychologically damage the child. But then on the flip side, Dr. Kumar says that kids need to be in the room, part of the conversation and a part of their own health journey, approaching it from a health point instead of a cosmetic.
Right.
And that they could be, sensitive to whether it's overweight or how they're viewed, but to understand the importance, right, the science, what's going on in the body.
Yeah. And
try to reach for.
Yeah. And by the way, the Eating Recovery Center is totally against surgery, but we see that the American Academy of Pediatrics has now flipped their viewpoint on that too, and they now do recommend it for kids, teens in extreme cases. Yeah.
All right. And Haley, you'll have more coming up at 7?
Yeah, we'll talk at 7:15 about this topic, and we'll talk more about why summertime is such a big issue.
Okay. We'll see you again soon. Thanks, Haley.
Thanks,
Let's get you out the door.